Hello, my name is Ashlyn. Today I'm going to be doing an intradermal injection. Before we get started, I am getting over COVID, so if I sound a little congestion or I cough throughout the video, again, I'm just trying to get over COVID and still have the residuals. So before we get started, just to go over our supplies, I have our medication, Tabersol, and then we do have the needle and syringe. This one is the 25 gauge by 5/8 in size. We have our gauze. We also have the 2 alcohol pads as well as our gloves. Before we get started, we want to make sure that we review the order from the provider and what we're doing today for our patient. So in this case, we are going to go ahead and do a TB skin test or a Tabersolin skin test. The order draws for 0.1 milliliters intradermal times 1 dose. So after confirming that in our orders against the EMR system, we'll go ahead and again gather our supplies. Before we're going in, we're going to run through our 6 rights of medication. That's going to be right patient, right drug, right dose, right time, right route, and then documentation. If there was need to do med calculations or convert or anything like that, we would do that before drawing up the medication. In this instance, we do not have to, as our medication typically is already prepared and doesn't need any calculation, and then our orders do not need any med calc. It's just going to be 0.1 milliliters that we're going to be drawing up. So next, after we have our supplies, we'll go ahead and go into the patient room. We go ahead and enter the patient room, close the privacy curtains, provide hand hygiene. Hello, Mr. Smith. My name is Ashlyn. I'll be your nurse today. Can you please go ahead and confirm your name and date of birth? Perfect, thank you. And then I will go ahead and verify with his wristband. So today, Mr. Smith, we're going to go ahead and do your intradermal TB test, which the provider had ordered for you. Before we get started, do you have any known drug allergies to any medications, any food allergies, anything that we should know about before we administer your medication? Nope, perfect. Okay, sounds good. So again, the TB test is going to be administered for you. What to look out for is after injecting this is just going to be on your forearm. And if in some instances, if you can't get a good access on the forearm, you would go then to the patient's back to administer this. Mr. Smith, we're going to be doing this on your forearm today. With injecting the TB test, you are going to get a small wheal, or it may look like a mosquito bite to you. That is what we are looking for when we are administering this medication. This means that we had successfully injected into the right area. Some signs that to look out for when we're injecting this is it may burn or possibly sting when the medication is going in or being injected into your skin. That is common. And then if you start feeling any adverse side effects, which is, any chest pain, shortness of breath, tingling in your face or arms, go ahead and please let us know, and we will go ahead and address those concerns. So after this, we would go ahead and then get the medication prepared. Mr. Smith, do you have any questions before we go ahead and get started? Nope. Okay, sounds good. So after this, we're going to go ahead and just get the medication started. Again, I would go ahead and perform hand hygiene. Next, we're going to go ahead and take our medication, which is here, and then I'm going to don my gloves. Again, the order is going to be a 0.1 ml of Tabersolin. Okay, so before we go ahead and start, I do this quite often within my office, so I would go ahead and just make sure I have my supplies, and before we're going to go ahead and take your alcohol pad and you're going to cleanse the top of the vial. We go ahead and discard this into our trash. Next, we're going to go ahead and open our syringe. And then we would go ahead and take off. Before we take off, we're going to go ahead and draw up air so we can go ahead and inject into the vial, and it's going to be 0.1 that we're going to inject air into the vial. So we're going to keep the cap off. We're going to place this down, and we're just going to go inject into the vial. Once this is in, we're going to go ahead and invert. We're going to push the air up into the vial, and next we're going to draw out 0.1 medication. I do not have any bubbles inside of my syringe, so I'm good. So I'm going to go ahead and flip out, pick up, and I'm not going to recap, but I'm just going to move this so I can show you. But I would not do this and keep my needle out like this if I was in a real patient situation. I'm just going to not cap it, but I'm just going to do the swoop method, and we're just going to leave that there. I'm not going to touch it until I am ready. Move the medication. Next, I'm going to go ahead and find the correct area on my patient's arm. So in order to do this, this is going to be his wrist area, and then this is going to be his antecubical space. And to do this, to verify the correct area where we're going to go, we are just going to do the 4-finger method from, again, the wrist and the antecubical space, and we're just going to measure here. And once we have done that, we can visually eye in the area where we're going to go. Once I visualize it, I'm going to go ahead and clean the area, and I'm going to start in the middle and counterclockwise out. And with this, I'm not going to wave my hands, I'm not going to blow on it. We're just going to let that dry. Perfect. Okay, Mr. Smith, so we're going to go ahead and inject the medication. If you can, just stay as still as possible. In this instance, if there was a, if the patient was sitting in a chair or I had a tray available, I would go ahead and move that and then rest the patient's hand comfortably on that so they're not holding it, anything like that. And in this instance, the patient has gone ahead and just had it comfortably in a correct position for me and the patient. So next, after it's dried, we can go ahead and taunt the skin, or just putting some resistant onto the this skin. We're just stretching it. So I'm going to go ahead and do that. Once I've identified my space, I like to just pull down. Again, I have my gauze nearby and then my injections ready. So I'll just go ahead and pull the skin, take the needle out, and you're going to go ahead and make sure that the bevel is up. And then you're going to do 3 fingers down here, and we're going to go at a 5 to 15 degree angle into the skin. All right, Mr. Smith, in 1, 2, 3. Perfect. Once there's in, you want to completely steady your hand. I'm going to now let go with my non-dominant hand, and I'm going to inject the medication. Perfect, Mr. Smith. We have successfully developed the wheel. I would go ahead and pull out. In this instance, this does have a safety guard, so I would go ahead and apply that. Then I would just go ahead and discard this into this sharps container. Then I would take my gauze and place it over. I do not want to press on the actual wheel because that is the reason why we created it. We do not want to get rid of it. If there was any blood or the patient would like a Band-Aid, I would go ahead and apply it lightly over the area. Okay, Mr. Smith, are you feeling okay? You did awesome. Okay, I would go ahead and trash those. Okay, Mr. Smith, everything looks okay. I would go ahead and put you back in a comfortable position. Here's your call light. I will just be outside to document this procedure. If you have any questions or concerns, please don't hesitate to give me a call. And again, if you start having any type of reaction, chest pain, shortness of breath, you feel lightheaded or dizziness, go ahead and just give us a call. Again, after any sort of injection, you do want to monitor the patient afterwards. I would go ahead and perform hand hygiene, exit the room.